I became interested in speech pathology a freshman here at Hofstra. I was deciding between special education and pursuing speech pathology, and I ended up choosing speech because it's more of a one-to-one environment. It's more medically based. So when it came time to apply for grad schools, Hofstra was one of my first choices. Right before my senior year started, they started this dual degree program that allowed students who were seniors to start taking graduate courses during their senior year of undergrad. So while taking my undergrad classes and finishing my degree, I started taking intro graduate classes for the speech language pathology program. My junior year as an undergrad at Hofstra, I was in the Speech 160 class, which is an internship placement. I was placed at the South Shore Center for Speech, Language, and Swallowing Disorders. My mentor was Steve Azofsky. He specializes in voice disorders and swallowing disorders. I spent like a day or two and a few hours a week in his clinic in the room with him and clients. So I had the opportunity to interact with clients, interact with the other clinicians in the practice, and the opportunity to speak to him before and after the sessions to talk about goals and to talk about treatment methods and therapy. So it was a great learning opportunity of what actual therapy looks like, and it made me very interested in pursuing swallowing disorders. As a first-year student in the grad program, you're placed in either the diagnostic cohort or a treatment cohort, but because I'm in the dual degree program, I sort of get a little bit of both. So this semester, I'm in diagnostics where we're doing evaluations, but I also see a client twice a week for 45 minutes. He comes to the clinic through the Committee on Preschool Special Education, so he's a CPSE kid. We work on language goals and facilitating language and sensory activities. Starting next semester, I'll be full-time treatment, so I'll have between 2 and 3 clients that I'll be seeing on a weekly basis, adults through pediatrics ranging in disorders. And because of this dual degree program, come summer, I will be in my first externship placement, where I'll be going to an outside placement and doing therapy under the guise of a supervisor. NSHLA is the National Student Speech Language Hearing Association that we have here on campus. For my junior and senior years of undergrad, I was on the board, so I served as the secretary and I helped plan events and fundraise. We fundraise to raise money for the SALTZMAN Center to provide services and scholarships for people who can't afford speech and hearing services. We were fortunate enough my senior year to get funding from Hofstra to go to the ASHA convention in Chicago. It's the American Speech Hearing Association. So they have this huge convention and all different presenters come, and you get to learn so much and meet with representatives from companies that produce speech products to people who are renowned in the field. The SALTZMAN Center is the on-campus clinic where speech language hearing services are provided. People from the local community and on Long Island come and get services for things such as aphasia, articulation disorders, speech delays. Our clients range from young children, so pediatrics, like a year or two, who come to us through early intervention services. We have children who come to us through preschool and all the way up until geriatrics. The staff and faculty of the Speech Language Department and the SALTZMAN Center Clinic are fantastic. They are always available to answer any questions you have, especially once you get into the clinic and you start having clients or you're doing diagnostic evaluations. You're given a supervisor, and that supervisor is there to help you through everything, to answer questions, to help you with writing, to help you choosing what diagnostic tools or goals to focus on that week. So the staff is really helpful, and they've really provided me with lots of great opportunities for personal growth and development in the program. My advice for incoming students or people looking at graduate programs and not sure where to pick is to do your research and find out about the program. Hofstra has a great program that's not only clinically based but also research, which is a great opportunity. You're not only knowledgeable about the literature that's out there on disorders and treatments, but you also have a great foundation on how to actually apply what you've learned to the real world.